So, David, that was good summary there of your programs. Not only just what you're working on in viruses, but also in cancer. Um, so I I thought we'd do a fireside chat session where we just talk about general things that are going on in the industry. And I guess one thing that comes to mind, we hear about COVID, and I think a lot of us maybe think, oh, that's in the past. It's not really relevant anymore. But that may not exactly be the case. And I was wondering if you could explain, why is it important to have another COVID vaccine?
Sure. For many of us who are generally healthy, we think, isn't the pandemic over? Why are we still talking about COVID? They refer to it as COVID fatigue. I've done a number of discussions with interviews and stuff
We can all
about
relate to
COVID.
that, I'm sure.
Oh, exactly. We all got tired of it. No. However, I like to point out there are a couple of things that is why COVID is still most relevant. One is the very basis of Project NextGen, recognizing that SARS-CoV-2 has continued to evolve, continues to produce variants of concern, as they're noted, and for various populations, those variants can be not only very severe, but can be put them at risk for mortality, for death,
Hmm.
hospitalization and death. So we need vaccines that give a broader coverage, greater breadth, and also last longer. People get tired of boosters, and so they end up just walking away from the vaccines. That's the only way to really provide either there's nothing really full protection, but it's really reducing the symptomatics, the symptoms that come with these types of viruses, and keep you out of the hospital,
Well,
faster recovery.
so David, do you think the COVID vaccine will be just like the flu vaccine, where certain populations are going in every year to get that? Is that kind of how
Yes,
you think it'll
yeah,
emerge?
yes, we do. But
Yeah.
there's also, I want to emphasize that for the immunocompromised populations. So let's take a moment and talk about that, because this is one that is well recognized in the medical community and public health worldwide, but not in the general public. Every time I discuss it, people say, oh, I have a cousin, or my brother in law has a condition that fits with that. So in the United States, there are an estimated over 50 million adults who suffer from various medical conditions. They might be blood cancers, they may
Sure.
have renal disease, they may have diabetes, they may be organ transplant patients where they're on immunosuppressive drugs, or they may have autoimmune diseases, lupus or multiple sclerosis, which puts them at risk. Various conditions, when you add them all up, they deplete a person's immune system from being able to respond adequately to antibody stimulation. And that becomes very important because the mRNA vaccines, they are designed to create and induce a very strong antibody response. That's our first immune barrier that is thrown up when an infectious threat comes into us. No. But if your body has been depleted from antibody response adequately, then what you have to rely on is your cellular immunity. You've heard of T cells and all. That's the other side of the immune system. Our vaccine is constructed to induce not only a strong antibody response, similar to what you see with the mRNA vaccine, but it's also constructed to stimulate a very strong T cell response.
Hmm.
And what is important about that is it is the T cell or the cellular immune system that drives the reduction of severe infection, the risk of hospitalization, the risk of death. It drives what's known as memory, and which leads to durability or long lasting. And that's why when we look at the need for additional vaccines, we're talking about for populations for whom the current vaccines are inadequate. So we need to have something that gives them a broader. If their antibody system is not going to work, we have to rely and do as much as we can with the cellular immunity. So we need it for that. And also, if we want longer lasting, greater breadth of protection as they're seeking with Project NextGen, we need to have at least the dual antigen approach that GeoVax has. We also have a candidate which has shown in animals significant success, and that's a three component one. So it basically is hitting not only the antibody, but then two other structural proteins to give you a breadth from the cellular immunity. So that's why we need next generation COVID 19 vaccines. As one, to do better, so we have an annual vaccine perhaps, because we look at what's the latest variant, reconfigure it, get it ready, and do that. That's what everybody was seeking at the very beginning of the pandemic. And then we also need to be able to address these populations. While there are 50 million adults in the US that fit into this cohort or this bucket of immunocompromised patients, there are over 400 million worldwide. So think about that. All of those people being at severe risk, which they can then carry the virus and infect other people. So we really need to approach this in a much broader and deeper type manner when you think about it. The breadth of the variants, so cross-variant protection, and also longer lasting. That becomes critically important going forward.
You know, David, you mentioned the mRNA platform, and I think we heard about that a lot during COVID because that's what the Pfizer and Moderna vaccines were based on. But you have a different platform that's been around a lot longer, MVA, or Modified Vaccinia Ankara, I believe. Tell us about that, how that works, and how that's different. I think one of the things that's compelling about that platform is that, in contrast to the mRNA, it doesn't require the same strict handling procedures, and it may be a little bit more appropriate for some of the developing areas that don't have really severe refrigeration, you know, minus 80 or whatever it is. Can you share with us about that, about your platform, and kind of how it contrasts with the mRNA platform?
Sure. So I always like to start, you know, what is a vaccine platform? A vaccine platform in and of itself does nothing until you take a specific antigen that relates to a particular disease, so a particular component of the virus, for instance, going after COVID-19. So you take that out of the SARS-CoV-2 virus, you insert it into the platform, let's say it's mRNA, and then you deliver that. And then you have the immune response, which gives you the immunization you're seeking. So that's what a platform does. So a platform in and of itself does nothing. It's a carrier. It's a vector, as we refer to it. And so from that, when you do that, then your next step is you obviously want to be able to produce sufficient product. In a pandemic or an epidemic, what is absolutely critical and most necessary is produce a lot of product fast. And that's how we broke the back of the pandemic. Nothing is faster than mRNA. That is its strongest pro, I would say, is the ability to go straight into manufacturing, produce a lot of product fast. Unfortunately, there are certain elements or attributes, call it features and all, that don't have the certain desired benefits. Is we now know that when you utilize mRNA, you have to continuously reconfigure it as you see more variants come up. So you keep hearing about the bivalents and the Omicron this and then JN1 that. So you have to do that. And then you also don't have the long-lasting power that we're seeking. They don't last, let's say, 8 months to 12 months. They last
the
2 to 6
durability.
months.
Yeah.
So that's frustrating. In the real world, though, what you really need with a vaccine or any product for that matter is you need to be able to distribute it and especially administer it wherever it's needed. So if you think about it, and if you're in certain regions of the world, parts of Southeast Asia and Africa and all, where it's not quite as developed, etc., and if you have a vaccine, in this case an mRNA vaccine, and it requires frozen state, minus 80 degrees Fahrenheit, and then when you deliver, so you have to have special equipment to have the vaccine there.
Right.
Then when you thaw it, it's only good for 4 to 6 hours. So you can't reuse it. You know, there are hundreds of millions of dollars of product that could have gone to places in great need, but they weren't utilized and they expired and they had to be destroyed. American taxpayer paid for a lot of those hundreds of millions of dollars for doing that. Well intended, but it could have helped and saved a lot more people if they had been able to be delivered. No. One of the benefits that we have with MVA is, I'm going to go back to, as a platform. First of all, it's not a sort of an innate vector, as I was speaking initially. It actually is a virus, a vaccine itself, and it's the vaccine virus that prevents smallpox and Mpox. So it has some what they call self-adjuvant. It actually does something in and of itself before you even put another antigen into it. So it sort of boosts and primes the immune system. So it's got an advantage there. One of the greatest advantages it has is it does not require frozen state or extreme refrigeration. it can actually be freeze-dried and delivered. And think about that in certain parts of the world where you could ship the product in a freeze-dried state. It's then simply reconstituted in a local clinic that can be administered, and it doesn't
And that
have
gives it a much
short.
longer shelf life too, I'm sure. And you don't have
Yes,
to.
exactly.
You can just
Exactly.
literally put it on the shelf in the environment. Don't have to
Exactly.
cool it or
We've
anything like
had
that.
product
Yeah.
based on MVA that's lasted more than 8 years
Hmm.
and still good.
Okay. Yeah, that's a pretty big benefit, especially when we talk about areas that don't have good transportation or steady power supply to support that. So, well, great. Well, David, thanks so much for sharing with us some of the details on the vaccine platforms and how they're working. It's been great talking to you. Thank you.
Thank you. Appreciate it. Enjoyed it.